stay. Got to get in there. Experience it, Randy.
All right, if you suspect or you know someone who's having a heart attack, what do? You jump in the car and drive them to the nearest medical facility, right? Well, what if they're not equipped to deal with the severity of this particular situation? SSM Health is changing the landscape of heart attack, stroke, and trauma care with something called TCD, Time Critical Diagnosis. Dr. Michael Lim is a cardiologist with SLUCare and SSM Health, St. Louis University Hospital, here to talk about it. Good morning to you.
Good morning.
First of all, my first sentence, you didn't like that. Get in the car and drive yourself. You don't like that, do you?
Well, there's a couple things. One, this is a statewide initiative, Time Critical Diagnosis, that's trying to make sure that the right hospitals are the places where the people who need them the most go. So before this, ambulances would have to take patients to the closest available facility.
Right.
Outside of the St. Louis area, those sometimes aren't necessarily well capable of taking care of somebody with a heart attack or more. And so having a designation, especially outside of Kansas City or St. Louis, really is important to saving lives. Secondly, no, you shouldn't get in your car. So over 40% of the people who die of heart attacks die before they ever get to the hospital. And the key behind TCD is to really try to make sure that everybody gets the message. No, if you are having chest pressure, chest discomfort, you're sweating, you're sick to your stomach, you might have radiation of your discomfort to your neck or your arm, you want to chew an aspirin and call 911. And the ambulance is going to take you to the right place. The ambulance is there to take care of you so that if something happens on the way to the hospital, that we can keep you alive. If we get you to the hospital alive, you can stay alive.
A greater chance of survival. So, and something else that comes into play here is a STEMI heart attack, S-T-E-M-I. What is that, and why does that require a higher level of care?
So that's sort of what we would call the big one. You know, when Fred Sanford used to put his hand up and say, Elizabeth, yes, I'm having the big one. So when ST elevation MI means there is at least one artery in your heart completely blocked. So there's a part of your heart that's not getting blood flow, and the heart needs blood flow all the time. So there is a time dependency and a time urgency to be able to open up that artery. Standard modern day treatment for a heart attack is open up the artery as fast as possible. So what that means is you and your loved ones and everybody else out there recognize these things are going on as fast as possible. Call 911. The ambulance will get you to the hospital as fast as possible, and that gives us a chance, once you're there, to open up that artery as fast as possible.
When we have a fire in our home, we all memorize our escape route and the danger zone and things like that. Are we savvy and are we educated enough as far as hospitals and what they provide in our area, or should we be?
That's the point, I think.
Yeah.
I don't think we should be. I think we can spend too much time worrying about what, where, when, how. In the St. Louis area, we are blessed. We have 17 hospitals that are all very well capable of taking care of you or me if we're having a heart attack, and the closest one is where we need to be. If we're not having a heart attack, you know, go forward. If we're having a bigger heart attack and we need a higher level of care, then it's up to those people at that hospital to transfer you on. So the thinking part about what's the best place for my heart attack, that needs to go away. Calling 911, using our EMS system, that needs to actually start happening.
And in the SSM network, it's St. Louis University Hospital, St. Mary's Hospital, St. Clair Hospital, DePaul Hospital, St. Joseph Hospital in St. Charles, and also Mercy Network has some of these hospitals capable as well. So thank you very much, Doctor. We appreciate all this very important information. If you want to learn more about all of this, we've got links for you to read up on our website, as well as our Fox 2 St. Louis app. John, he's wearing a bow tie.
Yes, I am.